Hello, and welcome to the Collective Impact webinar series. I'm Amelia Pasmai-Seeker. I'm the Deputy Director at the USBC, and I'm so glad to welcome you to today's session. These webinars are referred to as the Collective Impact webinar series, and they're held on the fourth Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. The purpose of this series is to share best practices and news about using the collective impact model for collaborative change. USBC member organizations and breastfeeding advocates from around the country can join us for these free webinars. The webinar presentation, handouts, and video recordings of this and past sessions can be found on the USBC website at usbreastfeeding.org/collective-impact. You can find the link on the chat box and in your webinar confirmation email. You can also find it on the USBC website. Under Webinars, select the Collective Impact webinar series. You can see and sign up for the other 3 series here as well. To streamline access, the webinars have been set up as a series. So once you register for a session, you're set. You will receive reminders for each webinar with the topic and the speaker details. We understand that it's not possible to attend every session live in the midst of your busy workday, so there is easy access to all archived recordings. For today's session, all participants are in listen-only mode. However, we hope the session will be as interactive as possible despite the virtual format. So please share your insights and questions throughout the panel's presentation. You can type your questions as they come up for you during the session. And here's how you do it. Go to the control panel on the right of your screen. If you don't see it, it may be minimized. Just click on the orange tab and it will pop back out. If you scroll down below the audio section, you will see a tab called Questions. When you click on it, it will open up a box for you to type in. If you have any webinar-related tech problems, please send an email to office@usbreastfeeding.org and our staff will do their best to help you. And that brings me to today's session, Stories from the Field, Adapting Lactation Care to the Constraints of COVID-19. So here we find ourselves. Right? The unprecedented challenges posed by COVID-19 and this pandemic have required flexible thinking and adaptive programmatic changes to meet the needs of breastfeeding families during this emergency. This panel discussion will feature stories from 4 lactation programs that have adjusted through the use of virtual technology, training, apps, and new distribution systems to meet the context of social distancing requirements. Individual and organizational shifts that we're all making inform the larger policy, system, and environmental changes that become collective action. So we see today's webinar as the first in a series of learning opportunities USBC is coordinating to support the First Food Field's response to COVID-19. This webinar is also going to preview the upcoming Thursday 30th launch of the COVID-19 Infant and Young Child Feeding Constellation. As we lead into today's panelists, we wanted to begin by highlighting some of the context that USBC has been helping to hold and to frame during this time. Hopefully you're all aware of our Story Collector tool. I'm sure Miriam or someone else will put the web link for that into the chat box. The way that this has been designed and what we are intending is to have a way to lift up the stories and be able to understand and discern the themes of those stories so that we can begin to have a shared understanding of what is needed in terms of response. Right? Because the individual experiences we each have as we're serving families, as we're galvanizing support and resources for organizations, all of those add up together to these larger consequences that create these larger opportunities for us to act together. And that's really the heart of collective impact, is recognizing that where there's need, where there's urgency, where there's capacity, all of those things come together and we have the opportunity collectively to make a change. And we are being asked for that like never before out of this pandemic. So the Story Collector tool is just one of the mechanisms that we've devised at USBC in order to listen to you and to hear from you. We are going to periodically be synthesizing the stories that you share into de-identified themes and quotes. Every care is taken to recognize the sensitivity of this time and how important and critical it is that privacy and confidentiality are respected. We have heard from some people that concern of anonymity is even political, that some people are fearing retribution personally or for their institutions if they speak too plainly about what is actually honestly happening in their facilities with the communities that they're serving and right before their eyes. And it is heartbreaking to consider the vulnerability that many of you are experiencing on top of what it is that you're witnessing and what it is that you're caring for. So we want you to know from our full beings as a staff team, we protect and respect your confidentiality, and we will treat your information with the utmost care. From this first synthesis, we saw the 5 themes that are currently on the screen. We heard about your fear and the uncertainty of this time. We heard about the changes to maternity care practices. We heard about the confusions of the recommendations and the guidance that are out. We heard about the great value that you hold on prevention and breastfeeding as a preventive part of the health interventions we can all be supporting. And we heard about the role and the need for telehealth, the ways you're utilizing that, the needs that you have for training. And as I said, we will continue to, from time to time, create a synthesis of the stories so that we can be using that to mobilize support. We also are in a position where we're hearing from lactation support providers, and we want you to know that we're also combining that into the themes so that we can be understanding again what it is that the first food field needs during this unprecedented time. So we are aware of the way that this is disproportionately impacting the communities that have already been carrying a disproportionate burden of our systemic inequities and health disparities. Right, so we know that there's an impact right now being felt in Black and Brown families that is not equal to other parts of society. And so specific populations also have specific needs and specific pain right now. So immigrant families, those who are houseless, those who are incarcerated, domestic and childcare workers, those who are deemed essential and who subsequently are not able to shelter in place, but they and their children are exposed in different kinds of ways. We understand that we need trauma-informed care for families. So we need training in ACEs, adverse childhood effects training, and grief support. And then lactation care for families is also changing, right? So we need culturally relevant care, but also information about how to advocate with hospitals so that they're triaging care rather than doing routine separation. We've understood that there's a very strong need for training around telehealth and an increase of warm lines and an understanding of how to provide socially distant care during this time. And then care providers themselves need support. Right, so we'll be continuing to look for opportunities to provide resources and training around holding your personal boundaries and finding support among your peers. Providing training and support for telehealth, we're looking for opportunities to provide free continuing education. And we recognize that there's updated resources and training needs around infant and young child feeding and emergencies. And in particular, we want to be helping lactation support providers understand the role that they play in responding to this pandemic emergency, which is just as critical an emergency, but unlike a tornado or an earthquake, it's happening all over the world at one time. So we all have a critical role to play in how we respond. And then together, we have a real opportunity to be advocating for consistent messaging that is supportive of and protective of breastfeeding. So with that, I want to introduce you to today's panel. Today we have 4 programmatic leaders who have offered to share their stories of adapting lactation care to the constraints posed by COVID-19. I'm going to introduce you to all 4 of them, and then they're each going to respond to 4 questions that we sent them in advance. So here's what we asked them to speak to. Number 1, what's on your heart and how are you feeling? Number 2, describe your workplace or the organization and the kinds of services that you've provided. Number 3, describe how COVID transmission and social distancing requirements changed things for the families that you serve. And then number 4, how did your organization adapt to the constraints and the new needs of this time? So as you can see, it will be a rich time of sharing and learning, and I'm delighted to introduce you to today's panel. So first today is Lucia Jenkins, who's been an internationally board-certified lactation consultant for 26 years and is the founder and executive director of Baby Cafe USA. She practices as a hospital-based IBCLC caring for newborns and facilitates 2 baby cafes, troubleshooting infant and older baby issues. She also has a private LC practice called North Shore Lactation, serving the greater Boston area, and lectures at lactation conferences on various breastfeeding subjects. Then we'll hear from Mia Rutherford. Mia is a lifelong Detroiter and mother of 2 with over 4 years breastfeeding experience. Mia considers herself to be an advocate of the underrepresented and a protector of her community, lover and caretaker of not only the infant that is born, but the mother as well. Mia's commitment to advancing breastfeeding equity through community-oriented breastfeeding service led her to the Mother Nurture Lactation College in 2015. As a member of this unique program, she earned both a community health worker certification and IBCLC credential. Mia wishes to provide a safe space where families can address and conquer their fears to initiate and continue the breastfeeding journey. She often utilizes her community health worker skills to address the barriers that prevent many mothers from fulfilling their breastfeeding goals. She hopes to implement a sense of empowerment in all families so they thrive as the best caretakers they can be with whatever resources they have. Mia desires to leave an impact that ultimately changes the culture and our overall perspective of what breastfeeding is and looks like in her community. And Amanda Alvarez is an IBCLC dedicated to helping all families reach their breastfeeding goals. Amanda works at Mother's Milk Bank in North Texas as Education and Enrichment Manager. In that role, she provides clinical lactation care, manages a multi-site baby cafe cluster, and directs educational programming for the organization. She's been an active member of the Tarrant County Breastfeeding Coalition since moving to Texas in 2015 and has served as chair for the 2017-2018 term. She represents Mother's Milk Bank of North Texas and TCO-BCO through leadership and participation in multiple maternal health coalitions. She lives with her husband, their 3 children, and a menagerie of pets. Amanda enjoys running, cooking, travel, and volunteer work in social justice. And then Nikki Lee is an LPN since 1971. She received her RN in 72 and graduate degree in 75. She's published the books Complementary and Alternative Medicine and Breastfeeding Therapy and a Breastfeeding Owner's Manual. She's the reviews editor for the journal Clinical Lactation and has worked as a lactation consultant in the Division of Maternal Health and Family Health at the Philadelphia Department of Health since 2006. She's also a guitarist, teacher, holistic lactation consultant, craniosacral therapy practitioner, baby body worker, and yoga instructor, and the mother of 2 wonderful breastfed children. So the panelists are going to please turn their cameras on, and we're going to thank them all again for joining us and being willing to share their story. So this is a reminder slide that as panelists, or excuse me, as the audience, you can go to your webinar control panel and click on the questions tab. And let's see, so Miriam, will it be necessary for me to stop showing my screen for us to see the speaker webcams?
No, so as attendees, we can see both. And I
Okay.
think because you're sharing your screen, you probably can't see the
Okay.
panelists, but they're all here.
Okay. Oh, I see. You can see them and I can't. That's what's happening. Got it. Great. Okay. Well, welcome. So, we're going to start today with Lucia. And if you could please begin, tell us about your experience,
Okay.
starting with what's on your heart and how are you feeling?
Well, that was a heavy question, Amelia. I thought about it a
Yeah.
lot. A lot of things are on my heart, but the first one, to be honest with you, I'm really sad for the loss that the mothers have um, from the presence of other mothers. I'm on the tail end. My children are all grown. And I was reflecting back on how incredibly important the presence of other mothers in my daily life meant to me when I had my babies and was just starting out. And it wasn't that I went out for specific help, but the physical presence of seeing their faces, their babies, being in their energy fields where they are caring for their children, they are experiencing the same kind of confusion, but the same love and devotion for their children. It's such a sharing, uh, it's something that feeds your own soul as you're also feeding the other women and the babies in front of you. And I think that that's when we speak about the village that we all thrive on as human beings. We are clan people. And without our clans surrounding us in a physical sense, there is certainly an incredible loss and aloneness that is generated. And I think that that's what I feel mostly. I feel frustrated that I can't magically make it all get better for everybody because being a mom, that's kind of what we do. That's what I've done all my life is kind of mother everybody. And so there's that frustration, but I feel the depth of sadness that this loss means for particularly mothers who are just having their first baby. And they have no idea what a gift it is to have other mothers in your presence as they struggle with their own babies. So I think that's the answer to my first question is basically I'm sad for them. And I'm trying to do the best I can to help alleviate that and help them understand that hopefully when this all gets better, we're all going to glom back on like magnets to each other and find each other in our spaces and
Mhm.
start sharing again.
Thank you. You want to tell us, Lucia, about your where you
So
work?
yeah, so for the major part that I do, besides being a private IBCLC and working in the hospital, is I am the founder of Baby Cafe USA, and our mission, as we're a very small organization, and our mission is to help support the development of community-based free breastfeeding support sites. And we now have 158 active baby cafes in 34 states. And we just got a paper published in the Academy of Breastfeeding Medicine. So it was very important to me as a clinician that when we have these support systems in our communities, that we are able to collect data on them to do some program analysis and find out if they're really working. And what I was so excited, the findings of the research that we did in the paper that we published was it showed that two baby cafes in very diametrically opposed areas of the country both had the same outcomes. The outcomes there was a positive correlation for mothers attending 5 or more times at baby cafes and ending up breastfeeding for at least 12 months. And as compared to women who didn't attend baby cafes as frequently. But what was so crucial to me was that the one set of mothers that we studied were in the San Antonio WIC population, where there was like a 97% of the percentage of women were on WIC, as opposed to the one in Massachusetts, where there was only 2% of women on WIC. The ages were different. There was a much older population in the Massachusetts population. The education levels were different. And it showed that the outcomes were the same if women had these opportunities, always free. Baby cafes are always free. We don't sell anything or market anything. And they're staffed by professionals who can offer clinical intervention right there. Every baby cafe has a digital scale. And along with the clinical intervention, we offer a space that's always comfortable and cozy and non-clinical setting for moms to come together, and partners too. Males are invited as well to many of the baby cafes, where as a group you can get together and just talk about your stuff, talk about anything that comes up. And we find that baby cafes are so attractive to moms. They're open regularly, once a week for a couple of hours, and you don't have to sign up. You don't have to be there each week. It's a drop-in system, so it's just like going and finding your little clan on that day to go and hang with. So that's what baby cafes are. That's what they're designed to be, and they're all funded by community money. One of my stipulations is that the baby cafes reach out to every kind of sector in the population they can think of to make connections with moms, to get referral points, to work with WIC organizations, with churches, with libraries, with YMCAs, anywhere moms and partners happen to be wanting to gather. That's what we're there for. It's just a resource.
So what have you done to shift in this time?
So what we did was, the first thing that I did as soon as there was the whole isolation thing, I just said, oh my gosh, we've got to figure out how to make baby cafes happen in a virtual mode. And even though I'd used Zoom before, I was like, holy smokes, I don't think Zoom would be safe on the public venue. It wasn't applicable because the free Zoom package you can only use for 40 minutes. So I frantically called my volunteer IT guy, and he said, we happen to have MS Teams. So I immediately got him to train me. Then within a day, we offered a webinar to all of the baby cafe facilitators across the country to join, where we did an open teaching time right on how to use this MS Teams. So everybody who wanted one contacted my IT guy. They got their own email address for our account, and they started making their own baby cafes. If they worked with an organization already that had a pro Zoom account, they were certainly able to use whatever they could get their hands on to try and set up their baby cafes virtually. So that's what we do. I run them twice a week, a Wednesday evening and a Friday morning, and we've had a great response. And what happened, we were having also, of course, people continuing to deliver at the hospital. So our lactation consultants gave those parents our Zoom connection right then, and MS Teams connection, so that they could go home and immediately hop on and join us. It was frustrating to not have the scales, and I realized how much we relied on them, and the moms relied on them, because we teach the moms how to use them so they can do their own assessments of transfer. So we were back to the basics of, okay, show me how the baby looks, put him up in front of me. Okay, he's a week old now. How many pees, how many poops? He looks pretty good. So there was a lot more of returning back to the old school ways of telling a baby's thriving. And I think having the constant connection with other pairs of eyes on that baby really helped them, the new moms. The seasoned moms just loved coming on, and there was lots of conversation about how cool your house looks, and just sharing your little toddlers that were jumping in, and the 4-year-olds and the 8-year-olds. Hi mom, how are you? Hi guys. So trying to create some sort of a community.
Nice. That makes sense. And I saw our other panelists all nodding with you in that sense of creating a community and going with it.
I had a couple of situations that I just wanted to throw out, which surprised me, which I hadn't thought of, that came up in the moms, and they were kind of interesting. The first one was that the moms who had babies that were just approaching 3 months at the time that we started the isolation were so concerned. First of all, they were glad to be home because they were supposed to be heading back to work, but they were really panicking about their child's social development at the age of 3 months. And many of these babies were singletons, so they didn't have older siblings around. And the moms were really cognizant of their babies blossoming social needs from 3 months to about 6 months. The development is rapid. And when we sit the babies at Baby Cafe and you see this little 3-month-old glom right onto another baby's face, and they're just like, wow, I recognize it. It's a baby. The moms were missing that, and they were really concerned that their babies were going to have really strange reactions to seeing human beings when they come out face to face. So that was one that the moms were concerned about. And the other one, which I hadn't even thought about, we had a proportion of moms whose babies were 7 to about 11 months old, and the moms had been in work mode for a good couple of months, and babies were in daycare. And so they got set into a routine. Now mom comes home and they're so excited because they were like, yeah, I don't have to pump. This is awesome. I can just nurse. The babies didn't want to nurse during the day. So I thought that was really interesting. There were, for the major part of them, only wanted to nurse before nap time. They were in this routine that they had developed when they were in daycare that I hadn't, I think of babies as being so flexible, but these little ones were pretty well patterned, and the moms were quite dismayed to find out that when they wanted to take an 11 o'clock break and cuddle up on the couch and nurse, the babies weren't always willing to do it. And anyway, it raised some questions in my own brain. The types of nursing styles that really babies exhibit when mom is there in their presence all the time. And we had a couple of moms, when they realized that this might be because they hadn't been in their baby's presence for the majority of the waking hours during the week, they were dealing with some guilt feelings about it.
Mm.
And
Well, thank you for sharing that, Lucia. I want to make sure that we hear from all of
yeah.
the panelists. And, I think if you're, there's been this, it makes sense to me that babies too would be adjusting to all the ways that the flow of life and the patterns just got disrupted and got changed, and hopefully we're all modeling resiliency and flexibility, and the babies will, come around to be experiencing that. So I wanted to thank you, Lucia, for sharing, and I'd like to move to Mia. And Mia, I'm going to start with the same first question. What's on your heart and how are you feeling and what's happening in your community?
Hello, everybody.
Hello.
A multitude of emotions, I will say. Currently, I work and live in Detroit. All of my colleagues and sisters that I work with, we all work and live in this area. And the way that COVID-19 has impacted our communities is we still don't know what kind of impact that will have in the future. So I'm a little fearful, but I do have like a huge sense of gratitude and how quickly a lot of community members have rallied together to help the community. Um, and also just community agencies and organizations that we work with already, and how we've been able to quickly collaborate and get things moving very swiftly to be able to continue to provide support to our families.
I celebrate that. I'm glad to hear about that. Do you want to tell me about your organization, what you provide, and then what changed?
Oh, yes. So, Prior to COVID-19, we were moving. We're movers and shakers. I work with some very innovative and creative women. I mean, they are powerful women. So we were working on multiple projects all at once. We really trying to increase impact and increase access. Even before COVID, there's still sometimes there's a barrier to access to skilled lactation support. And we were really working on establishing relationships with other agencies and organizations and really trying to strengthen those relationships as well, those existing relationships. So I know I'm very vague, sorry.
We got a picture. And then suddenly you were in a pandemic. What happened for your community?
Disastrous. First and foremost, I mean, a lot of families in our community rely on emotional and physical support outside of their household. Um, so it has really impacted how we function traditionally and culturally. And I believe that was already discussed earlier. So trying to we're not only focusing on breastfeeding, but sometimes we're having to address those emotional needs first and
Mm-hmm.
acknowledging the impact it may have on a mom's mental health as well.
Yeah. Yeah, I was really fascinated in your bio, this combination of community health work and being an IBCLC seems like, being able to bring lactation support, but through the lens of recognizing the other psychosocial supports that are needed seems like a way to really be able to do comprehensive care.
Absolutely.
So what are the ways that you're adapting? What's changing? How are you shifting your services to meet the constraints?
Oh, goodness. So we were already working with organizations to receive referrals and, like I said, to provide more access to lactation consultants in the area. Um, but of course, this happened. So a lot of our families lost access to a lot of agencies that they relied on heavily. And a lot of people, of course, are working remotely. I'm still at work, but
Hmm.
support is a continuum. I'm in the hospital. I see moms 24, 48, maybe 72 hours. There's only so much that you can do within the hospital. So, moms need follow up, and I'm unable to do follow up. Of course, there are restrictions to the hospital system right now. So we've had to shift where we weren't originally doing virtual support groups and we weren't originally doing virtual consults, but we quickly transitioned into that mode. And then also, we are still seeing moms in the community physically because everything cannot be done virtually. Um, and thanks to a lot of people, we had a fundraiser. Well, we have a current fundraiser going on right now where a lot of people have donated so that we are able to purchase PPE, and people are donating PPE, breastfeeding supplies, just so that we're able to continue to support our families in a physical and virtual sense.
What are some of for those who, aren't familiar with how to do in-person visits safely, what does that look like?
Well, we're doing it the same way we're doing it in the hospital. So the beautiful thing is our backgrounds are very diverse within Southeast Michigan IBCLCs of color.
Hmm.
Um, we all work in different capacities. So we have been utilizing a lot of resources that have already been put out there through organizations like LER, for instance,
Hmm.
provided some guidance, and I'm sorry, I'm forgetting names and agencies, sorry.
It's
But
all right.
we're just utilizing a lot of the resources that are already put in place so that we were able to do this safely.
Hmm. That's wonderful. Yeah. Well, thank you. Thank you for doing both and, for finding the ways in this time to be able to continue to recognize, there's mental health needs, there's psychosocial supports that are needed, and that you have to have a kind of robust
Yeah.
wraparound
So,
process in order to meet everyone where they are.
so I will say that with our when we were able to shift virtually, we have the virtual prenatal breastfeeding class, but we also have a virtual support group where we are making sure that we have licensed mental health professionals in that
Oh,
group
wow.
so that we're able to address those needs.
Nice. That's critical. That's really cool to hear about. Thank you. All right. I appreciate you sharing, Mia. And I'm going to move to our next two panelists, and then we'll cycle back for questions and answers for everyone. So next up, Amanda, I'm wondering, again, just to start, what's on your heart and how are you feeling? Oops, I don't think we can hear you. You might be muted.
Okay, hi.
Now we gotcha.
I think I have the same stressors on my plate as everyone on this call. I wear a lot of hats as a professional and as a parent and as a partner, and I could talk for an hour about those things, right? But what I want to add, where my mind really went with this question was, I'm in a really secure position. I have an excellent secure job, and so does my partner. And so we're able to, because we don't have the stress that the majority of the country has right now, I have the privilege of thinking of innovative ways to change my practice and opportunities to participate in webinars and learning systems that I've had to kind of put on the back burner for a long time. I've gotten to dig into doing some different roles at work from what I normally do and really understand other people's jobs within my organization. And again, I'm going to sandwich that with recognizing that that is an extreme privilege, and I appreciate it every day because I know that I could list every stress I've got, and it's nothing compared to what the parents we serve are going through right now.
Yeah.
So that's with that one.
I think,
Yeah.
gratitude, gratitude is
Absolutely.
a great place to keep our hearts.
Yes.
So tell me about your organization and what you had been doing, and then what happened.
Yeah.
How'd you adapt?
So I am an IBCLC, and I practice through a really unique position at Mother's Milk Bank of North Texas. So we are a Human Milk Banking Association of North America milk bank. So like every nonprofit milk bank in the country, our mission is to provide safe donor human milk to medically fragile babies. It's what all the Havana milk banks do, and we all do it beautifully. Again, I have a great privilege at that milk bank in that my role is to enhance our mission. We recently rewrote the mission statement, and it includes the equitable provision of donor human milk and breastfeeding support and advocacy. We're in an excellent position to contribute to those fields, and my role at the milk bank is that specifically. So I sit on coalitions, I participate in work groups, I lead classes, I lead 2 baby cafes, and I've got some feelers out to open more sites. Even in the midst of that, people are reaching out right now. And then I also provide clinical care as a safety net. So I always refer to our community-based lactation consultants, WIC, private practice, all sorts of IBCLCs in the community. But when there's an urgent need that can't be met immediately by someone in the system, I have a great exam room at the milk bank, and I see clients there at no cost to them. So all of that has changed very dramatically and very suddenly in the midst of COVID-19. But again, it's been an opportunity to learn what we could do better and what we could do differently. So I've got a whole lot to talk about. So what I thought I would do is give kind of a once over of what's going on at the milk bank and milk banks all around. And then in questions, we can get into the details of it. So human milk banking is essential. The milk that we provide to the babies that we feed is their life-saving health care. It's not a lifestyle choice or a breastfeeding choice or parent choice. It's absolutely essential for the lives of these babies. And because of that, we have had the responsibility of being proactive throughout this entire pandemic. So very, very early on, before we were doing more dramatic things like closing to the public and things like that, we had to assure that we were providing safe milk. That's number one top priority. We've always provided safe milk. So that's something that we're good at, and it's something that we're good at monitoring. Havana has great guidelines on how to do that. But we had to really read up and make sure that the research was there, and now we're involved in further research to ensure that the milk supply is safe for medically fragile babies. So within the milk bank, the way we changed it at our specific location, milk handling stayed the same, right? Like we've always had a sterile environment, and we've always pasteurized milk. But now we've kind of put a bubble around our lab staff. We've segregated them from the rest of the staff because we cannot afford an exposure among them. They are absolutely the most essential people in the building. They have a highly specialized job to do. So they have their own entrance, their own bathrooms, their own break room, and then all of the backup milk lab staff, people like me who know how to help out in the lab but are definitely not milk processing experts. We can't come into contact with the lab staff, so that if we did have an exposure, we've got a way to swap out some staffing and keep operating as usual. Because not processing milk and not distributing milk is not an option. So that was a very, very early and immediate shift. We also closed the building to the public, which was a really hard thing to do for me because I'm the one that invites the public in, right? I spend time going out to see them, but I have them in the exam room. I have them in the baby cafes. I lead tours for WIC peer counselors and birth workers and all these people who want to come see this amazing facility we have, and all of that had to stop. But again, it's just in an interest of protecting the staff that are essential, that need to be there. So that's the first thing we had to be proactive about, was milk safety. The second thing was milk delivery. The majority of the milk that we dispense goes out through hospital NICUs. That's where medically fragile babies tend to be. We never had a shortage of breast milk, but we did see an increased ordering demand from the hospitals that we serve. And I think all of us saw that in our personal lives too, right? People tend to stockpile in stressful times. So we had to do some things to, we never limited how much milk went to a hospital, and a baby never went without milk who had a medically fragile diagnosis and needed the milk. But we did have to kind of throttle their ordering for just a little while to assure that there would be no shortage, to make sure that no one would go without milk. And so that was an early stage. We've actually already been able to roll that back, and now hospitals can order at their usual capacity. And a few hospitals that we serve provide donor milk for healthy babies who need a temporary supplement. We had to pause that program, but we've been able to reinstate that as well because we throttled it early to make sure we had a handle on the situation.
So Amanda,
go ahead.
In the interest of time, so if there's is there, looking at all your notes, is there one last thing you would really emphasize about the pivot?
Yes. So the big fun things that we've gotten to do that I hope last forever are the new relationships we formed in the community. So now, instead of our donors and our applicants that want to be donors having to go walk into a lab where they may or may not feel safe, or walk into a hospital where they may or may not be able to, we have instituted curbside blood draws at birth centers all over the Dallas-Fort Worth area. We've contracted with a home visiting phlebotomist who can do safe draws in people's homes. We've put me behind the wheel of a car to go pick up milk from donors because they can't get it somewhere and drop it off. We've started doing a whole lot of overnight shipping for donors who are in rural areas. But really, we've gotten outside our comfort zone, and the response has been overwhelming. We are not behind on milk production. We are not behind on donor screening, and it's because we were proactive and got out there and really hustled.
Awesome. Thank you for sharing your story, Amanda.
Sure.
So thank you. So I'll pivot now to Nikki. Do you want to share about what's on your heart? How are you feeling? And what were you doing? And how did it change?
I've been the lactation consultant at the Philadelphia Department of Public Health since 2006, and I've been doing mostly education and training and outreach and policy, and then supervision of our lactation staff. So we have an assortment of credentialed lactation helpers that work in our health centers. Because I'm originally a public health nurse, I think that I had the opportunity to serve on the Philadelphia Emergency Call Center, answering calls from providers and the community, and getting to really experience how completely unprepared our nation is for disaster, and seeing and feeling the impact of that on people's lives. Sometimes it's been really devastating, and I come home and I can just lie down on the floor and stare at the ceiling, or go for a hike around the neighborhood, just to, like, everyone's doing their best, you know, everyone's doing what they can, and they just aren't prepared, and the testing system is not prepared, and just the care, it's just every kind of situation. So I'm getting to deal with that. So it's not specifically related to lactation, but it is related to my original training and education as a public health nurse. Like Amanda, I'm a white woman of color. I have a lot of privilege in my personal life. So, and I'm very much, since working on the call line, I've become so much more painfully aware of that. Anyway, so that's what we go. So my heart's heavy, and it's also grateful that I can do something to be helpful. That always feels good. In terms of what's happening, I work for the Division of Maternal, Child, and Family Health, and we offer a number of different services for families and community, you know, with mental health care and lead screening and safe sleep and breastfeeding help, and this is all available through our health centers. We also we get funding from Title V and from Healthy Start. So we have some of our lactation staff, 2 of them are able to do home visits. And we have another partner who is bilingual. Anna is from Bolivia. She also is a partner with Congreso de Latinos Unidos, which is a big advocacy organization in the community. So we've all had to adapt to the world of Zoom for everything. All my meetings, the multi-hospital task force meeting is on Zoom. Our Pennsylvania Equity Work Group meeting is on Zoom. I mean, everything is, here we are in the virtual world. The big thing that our health department did was that we had decided, our director, Stacy Kellum, started, got a lot of support for the idea of initiating a pilot project to examine the impact of the Pacify app on our community. And we had set up a pilot project where we were going to recruit 350 families from our communities, from our health centers, from a children's hospital in Philadelphia. And after COVID hit, we just forget the pilot project. We just opened it. We just launched it. So now every family in Philadelphia has free access to the Pacify app. And the unique thing, that's what Pacify did with us, which was our request, was that when the calls come in, which are the calls that we answer, our lactation staff is contracted to work Monday through Friday, 9 to 5. They get a phone call. We get to answer the phone first before the national pool of lactation providers answers. So families calling from Philadelphia can get a Philadelphia helper.
Mm-hmm.
And we have a certain amount of time. If we don't pick up the call within half a minute or so, then it goes to the national pool. So people can always get help. But the twist on it is that we can do things locally. And so our lactation team has been able to make connections with people, you know, can call them outside of the app and provide support and connect them to other resources. So that's been a wonderful twist. And the Pacify staff have been very flexible and creative, working with our team, Isaac Leaf and Anna and Jaleesa and Tahira and me and Stacy and Nick and Tracy, all these people whose names need to be honored for all this work, to make it fit our situation. And we're still tweaking that a little bit, just trying to make it. Anna's on board because she's bilingual. So we've had almost 300 families have enrolled in the Pacify app since we launched it. And we haven't gotten that many phone calls yet, but the thing is that with the Mississippi research that was published about Pacify, just downloading the app increased breastfeeding. because I guess people felt they had that instant, they had whatever, who can make up a story why that is, but that's what happened. So we are continuing to launch publicity about the app, distributing information to all the hospitals, the WIC program, every organization in the community. It's actually, because it was on our own media channel so much, Channel 6 in Philadelphia and the Philadelphia Inquirer, it got picked up by some national news services. So some of you might have read about it in your own networks. So it's gotten big publicity. It's a very exciting thing to be doing, and we're looking into extending it, and we're looking to keep nourishing it, because it's only a month old, it's a baby, and we need to be supporting the growth of that throughout the community. Some of our staff, Tahira this morning, said that she felt that people would be more likely to receive telelactation that way through an official recognized app that they could have on their phone. So we offer great lactation services through the health department, but we don't have an app that you can download and get to. So it makes it incredibly convenient, and the timing is perfect. So
Thank you. Yeah, thank you for that. So I hear across the board of this panel, I hear this, the flexibility and the utility and the way you all have been really mobile and facile and just recognizing the systems and the ways of being that have been, all are going to have to pivot. And I hear from all four of you, the ways that your programs utilize technology, recruited in the case of in-person visits, recruited the equipment that you needed in order to be able to, where it was really important to still do in-person care, that you're each finding the way to do that. We have just a little bit of time left, so I wanted to, if I may, Mia, tap you've got the two hats that you wear. So perhaps from your community health worker lens, I'm just wondering, do you have anything overall to say? We saw that slide I shared about how lactation support providers themselves as a community, we all have to be finding these ways to take care of ourselves. And I'm wondering if you have anything you want to share from your life or from your group about how is it that you're taking care of yourself, physically, emotionally, or spiritually, in order to be able to continue to support families at this time? What do you have to share for yourself, or what would you advise for others? However you want to take that.
Okay. Well, first, the first day that this happened, so I believe the first thing that happened when everything fell apart was the school shut down. So I've been separated from my children since that day. I had to send my children to my mom, or I would not be able to do this. Um, so basically, to be able to work with such a fragile population, in the hospital, we are working with premature babies. We're working with moms who are having to see their babies in NICU, and just our moms and babies on the floor, very fragile population. So having to isolate myself for the most part.
Yeah.
But
Okay.
I do have my villages, and we do check in. And Southeast Michigan IBCOC's color, we are more than just colleagues. We have really been leaning on each other. I mean, we have been fully leaning on each other for emotional support during this time. I will say that I do completely unplug. I pick and choose what news outlet that I want to listen and watch. Completely unplug. I do a lot of yoga. I drink a lot of water. I take my vitamins. So I'm just, oh, and also accessing our own telehealth for mental health services. I mean, we've all even discussed that as well. And I know here at my job, there's lots of hotlines, and I think with my insurance, there's also telehealth options for mental health. So I'm just completely recommend everyone to tap into those resources. But I think all of the above, just being able to lean on one another during these very, very difficult times has been the only thing that has really been getting myself through, and others as well.
Oh, I'm really glad that I asked the question. And I had to remember to breathe after you shared that you've quarantined from your children, and so I just really honor I honor your mother, and I honor your children, and I honor you. Yeah, yeah. Wow. Wow.
Yeah.
So
Thank you.
this is what showing up looks like. And so I'm really grateful for everyone on this panel. Um, so we've got one announcement in the form of an invitation. So, and we recognize that in order to get through this, it's absolutely going to take everyone, right? And so at USBC, on Thursday, 2 days from now, we're launching the COVID-19 Infant and Young Child Feeding Constellation. So there are two organizations that are running point on supporting this effort. So the Carolina Global Breastfeeding Institute and USBC, we're working together to hold and build the container for this collaborative. Dr. Anjali Palmquist at CGBI, her specialty is infant and young child feeding in emergencies, so she's really bringing the content expertise, and with a lot of help from the USBC staff, I'll be supporting from the logistics and facilitation side. And we've recruited an advisory council of emergency response and strategic public health partners. So these are organizations that are international or domestic experts in emergency response, and public health partners who have experience with mobilizing in the face of past emergencies like SARS, or otherwise know how to do this in a way that the first food field needs to learn, and we need help and support. So the Constellation participation is open to any interested USBC member organization. When you sign up, you select your primary and your alternate representatives to serve on that constellation, and you pick who's going to come to any given meeting. But we are working with Anjali to load the file library, so there's lots of resources in there. But the good thing to know is that even if you are, it's a great time to become a USBC member organization if you work in a group that hasn't done that yet, but also joint collaborative work that comes out of that group is going to be shared with the public. So, those work products are going to be available to everyone so that we can be, really working and lifting one another up. And that's really what the beauty of collective impact is all about. And I think what's special about the way that we're doing that at USBC is that we are centering equity. So this constellation, soup to nuts, is designed with the real focus and intent of recognizing disproportionately impacted communities and the ways that community leaders are going to need help and support, training, equipment, and access, hopefully also to funding, to be able to make these kinds of adaptations that today's panelists shared, to be able to, have anything that they need from, a increased data plan on someone's phone to, pump and instructions to PPE equipment, like the training to do telehealth. We envision mobilizing the kind of response that gets real difference into communities where it is most needed, and like we will not. Babies aren't going to starve on our watch, okay? And we're going to figure this out together. So the Constellation meeting is one place to do that. And we're also going to build a community where we're here for each other and we're in each other's care, and we're holding up the understanding that breastfeeding saves lives. And so we all have a role in this moment, and we're going to collaboratively build a container on that intention. So thank you, panelists. Thank you, Amanda. Thank you, Nikki. Thank you, Lucia. Thank you, Mia, for being here and for sharing your examples of the ways that you're pivoting in this time. And I thank all the participants who joined us today. And I hope to see many of you on Thursday. And, as often as we need to keep on figuring out how to do this. So thank you, everybody.
Thank you, Amelia.
Yeah. Bye.
Bye, guys. Nice seeing everybody.
Yeah.
Yeah, be well.